gonna go ahead and check your wristband to confirm everything. Looks good. So your doctor did give an order for you to receive an NG tube insertion today. So I'm just gonna go ahead and start by raising the head of your bed into a high flowers position. And after this, I'm gonna put on my gloves and explain to you the process. Alright. So the NG tube is a tube that goes through your nostril, and then through your esophagus, and then down to your stomach. And what it is basically means for medication administration, feeding for patients so they can get their nutrients, and also suction. Okay? So this is the NG tube, and do you actually have a nostril that you prefer it going through? Your left nostril? Okay. So I'll just explain to you the process of everything and guide you through it step by step, okay? So I'm just going to go ahead and start by measuring the tube. And we're going to start from your nostril and then to your tragus, and then to the throat, and then I'm going to measure down to your xiphoid process, and just add an inch to that, so around 55 inches is the mark. So this is how much we'll be putting into your nostril today. And to start, I'm going to go ahead and place this towel around your chest. And what's going to happen is I'm going to go ahead and lube the end of the tube, and I'm going to push around 3 to 4 inches of the tube in, and then, or whenever it hits the back of your throat, your pharynx, okay? And then we're going to take a break from there. And after that, after you're comfortable, whenever you're ready, I'm going to go ahead and push the rest of the tube in. But when you're ready, let me say count to 3. On 3, I want you to take a big gulp and continue swallowing as I push the rest of the tube in, okay? Are there any questions for me? And also, there may be some discomfort, coughing, and gagging, but just bear with me. It is a painless process, okay? So if there aren't any questions, we're just going to go ahead and start, okay? So I'm going to go ahead and tilt your head down, your chin down, so it's an easier means of inserting it, okay? And then count of 3, I'm going to push around 3 to 4 inches in when it hits the back of your throat, and we're going to take a break, okay? 1, 2, 3. And then, alright, we're going to take a break right here. And just let me know whenever you're ready, you're comfortable, okay? And after this, I want you to take a big gulp and continue swallowing as I push the rest of the tube in, okay? You're ready? Alright, on the count of 3, I want you to take a big gulp and continue swallowing. 1, 2, 3, swallow, 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 swallow. Alright, perfect. I'm just going to go ahead and secure this by wrapping some butterfly tape around your nose. Alright, perfect. So from here, I'm going to just wipe some leftover residue. Alright, from here, we're going to go ahead and do a chest x-ray to make sure the tube is in its proper placement. And then I'll come back for your NG tube removal, alright? Are there any questions? No? Okay, I'll come back later. Hello, I've come back for your NG tube removal. Could you just please verify your name and date of birth one more time for me? Okay, perfect. And I'm just going to go ahead and check your wristband just to confirm. Looks good. Okay, I'm just going to start by putting the head of your bed into semi-flawless position for easier means of removal, okay? So your x-ray did show that everything was in the correct position, and your NG2 insertion was completed. It did everything that needed to happen. So I'm going to go ahead and start by putting on a new pair of gloves. And this will be a quick and simple process. So just to start, I'm going to go ahead and place the towel on your lap for any substance fallout, okay? And what's going to happen is I'm going to remove the tape around your nose, And then what's gonna happen is I need you to take a deep breath in and just hold it as I continuously pull the tube out. Okay, can you do that for me? Perfect. Are there any questions before we start? None? Okay, I'm just gonna start with removing it, okay? Sorry about your hair. Alright, so from here, I'm just gonna pull the tube out, and I want you to take a deep breath and hold it in, okay? On the count of 3, deep breath, hold it in as I pull it out, okay? 1, 2, 3, keep holding it. Perfect. Alright, you did so amazing. I'm just gonna go ahead and wrap this up, and you're all done. I'm just gonna wipe the residue. That's good. And call bell within reach. Just let me know if there are any questions or if you are needing any assistance, okay? Have a good day. Hand hygiene.